lot of the money that we currently spend in the NHS goes on crisis care. I speak to a lot of constituents in my constituency who very often can't access crisis care. So I think one of the things that I've been advocating is a kind of that very important first contact with a crisis team. When somebody is in a state of crisis, they need the reassurance, they need to have that single point of contact, and they need to have clarity about how they're going to access that piece of crisis care.
It should be possible for you to go to a place of safety in a health-based setting. It should never be necessary for you to go into a police station, except in the most extremely unusual circumstances.
When I've accessed crisis services, I've often found the support that I've received to be irrelevant. For example, when I was under crisis home treatment care, somebody would come to my home, take me out for coffee. I remember one occasion really well that we went out and she just sat there, and I just sat there, and I came home and thought, what's the point? How's this helping me in any way? I mean, what impact is this having on the crisis that I'm experiencing?
A huge number of things I'd like to see change about crisis care. One of them is actually being able to access it when you feel that you need it, so that you don't then end up accessing it too late when you're much too ill and maybe you'll be detained. It's better for the individual, and obviously it is cheaper, way cheaper.
There are a number of people who become very ill, but there is always a little bit left of that person who's trying to connect, who's trying to get control. And imposing further rules on them, it takes away their confidence, it takes away their esteem, they become dependent on services, and that can be life-term, and it's totally unnecessary. I think that the restrictive practice entraps. They may be in distress at this moment in time, but you're actually now turning people into patients.
I feel that the support that I've received with my physical care needs and needs around my disability has been substandard at best. I slipped and fell one evening in my room. I called for help, and the nurse assumed that I was attention seeking or having a run or something of that ilk, and that I could get up off the floor, but I was choosing not to. But I actually couldn't, I physically wasn't able to, and she just kept shouting at me and telling me off. I ended up that evening, I was on the floor for a total of 9 hours.
It's vital that people with mental health problems are very, very active participants in their care, to the point that they are the ones who are making decisions about the care that they receive. It has to be a partnership.
If somebody presents with a range of mental health problems, I think they should have the right to compassionate care. It should be integrated, it should be of high quality, there should be transparency about what the care plan and what the care pathway is going to be. It should be delivered by well-trained staff, and it should be done in a way which is humane and compassionate.
Well, I hope that firstly from the CQC's perspective that our activities will be very visible, that the public will know that mental health services are being inspected and regulated, and at the local level they'll know when their local service is being inspected and regulated, so they will have the opportunity to participate actively in helping to evaluate that service. We hope that over time, as inspection takes hold, that we'll see services improving in the direction that I just described, that they will become more responsive, particularly to people who are in a crisis, and we very much hope that the feedback we get from service users, which will be a very important part of how we make our judgments, will reflect that cultures are improving, that staff are displaying the values that we think are important in mental health care.
The overall impact is, what it has is that the service users have got a safety net, and it's not just professionals, it's someone else that's looking out for them, and that's us.
It's about total inclusiveness, and I am really, really pleased to be a part of such a fantastic organisation.